I think using a term like epidemic for diabetes in particular is not too strong.
Our men just don't go to the doctor unless they're sick. I mean, very sick. That's just it's just tradition.
The Waccamaw Siouan tribe has never had a health program. Never.
In healthcare, there's such a demand for high speed. Okay, we got to get you in, get you out, get you in, get you out. And that really pushes against I think, some of the understandings of what care is.
It has been more than just a short-term project, because what we're doing is an innovative effort to access health care, adequate, appropriate health care for American Indians.
We also have our we have Indian royalty. They're coming to the arena.
The American Indian Rural Health Outreach Project is an ambitious collaboration between regional nonprofit organizations and 5 of North Carolina's eastern Indian tribes to improve the health status of American Indians in the eastern part of the state.
For American Indians in North Carolina, there are very noticeable health disparities in a number of areas. As an example, American Indians are 3 times more likely to die of diabetes than the white population. For cardiovascular disease, American Indians have a 40% higher mortality rate for cardiovascular disease. And it is not just isolated to chronic health conditions, other conditions that are related to health. Some of the data on sexually transmitted diseases, there's higher rates for American Indians than the white population. So there's clearly, it's not just morbidity, it's also quality of life as well as complications associated with certain chronic and acute health conditions.
Working on a $600,000 federal grant spread over 3 years, health advocates have worked with the tribes as they empower themselves in their own communities to offer culturally competent health care and to gather Indian health data. The project helps the tribes to hire community outreach workers who find ways to remove barriers to medical care and establish events and regular activities that raise health awareness.
Community health outreach workers cover a wide range of activities, from going house to house and speaking to people about health, to setting up classes and seminars with physicians and local government agencies for the community, to prescription assistance programs, HIV and AIDS counseling, even some financial aspects of things like, as I said, prescription assistance for those who can't afford it, and also financial counseling for those who are not eligible for any other programs, but perhaps can make better use of their money in order to afford their health care. So it covers a tremendous range of things, and from birth to the grave.
Our programs have been able to educate them on how to care for themselves better. It's helped them to realize they need to go get checkups. Before, they wouldn't go unless they got sick, especially the males, and that's what we're focusing on now, are the males, because we feel like we've brought our females up to par. Now we're targeting the males, and we're also working on, in this new project that I plan to, that we've applied for, this grant, we want to have a navigator that will go with them to the doctor to interpret the doctor's language for them, because our people have missed so much by not understanding what the doctor was actually saying. And when they go in there, they panic. Or they're so sick they don't realize what he's saying or what they actually need to do after they leave the doctor's office, or they don't realize. I heard one lady saying, I was so glad that I was able to catch what she had said. She said, I didn't realize that there were shoes for people that was a diabetic. I didn't realize that you needed to go get your toes trimmed, that there was a proper way to do it, that it was so dangerous. She said, and I've learned that through this program. It's simple things that we overlook that's new to them, that they were never educated about.